Welcome, everybody, to Omnigenics. Today, we're going to spend some time with a couple of very special people talking about exosome testing. We have with us Cliff Layton, CEO of Omnigenics. I'm John Altshuler, president of Omnigenics. And of course, we have visiting with us today Mike Mooney. He is our lab partner and manufacturer of what we call the absolute gold standard in the market. And we're going to talk about testing today. Welcome. Exosomes, what testing looks like, why are labs testing, why should labs test, and we're going to talk about exosomes here for a few minutes. It's going to be a very short background on exosomes, but we're really going to focus in on the testing side of things and why testing matters. And of course, Omnigenics really feels that we're positioned in the market to meet all those standards and really exceed them. But I'd like to start by introducing our guest today is Mike Mooney. He's the VP with our lab partner, has a couple of decades of experience in this area that we're discussing today. And so I want to start off with a question, Mike. And you've spoken to a great many companies, I'm sure, over the course of time that have said, well, we've got a product that we believe in, we've done the testing, and they feel like they know what they have, but do they really?
You'd hope. I think there's some labs that are doing pretty good work out there outside of our team, but at the end of the day, there's no real rule of what you can call an exosome. So there's a lot of people riding the wave of the excitement of what these exosomes are, and frankly, there are just teams that are producing products that when we look at them, they're not really alive anymore. They're room temperature for some reason. They're turned into powder form, which biologically is just not going to, make things happen the way we want them to happen. So no, there's a lot of products in the market that say they're exosomes that they're actually not. So testing.
Well, that makes perfect sense. It's kind of a hard pill to swallow because I think practitioners invest a certain amount of time. They look at the research, the data kind of shows it, and they kind of go, well, okay, that works. But let's spend about 15 minutes here. Let's dive into some of the details. And, when we look at exosomes, and maybe you can just give us an extremely quick definition of what an exosome or an extracellular vesicle actually is.
Mm-hmm. So the way I kind of describe it is if you think of the skyline of New York City, all the tall buildings, those are the stem cells. And the only way they can conduct business with each other is the bike messengers, the telephone calls, the information that's being exchanged between them. So when we talk about cell-to-cell communication, we're really talking about exosomes delivering that information back and forth to get the job done.
So one of the terms that I hear a lot when it talks about exosomes and what they're able to deliver, this messaging, the signaling you're talking about, it really is kind of defined as cargo. What does cargo actually mean in that respect?
Well, exosomes can produce a lot of things. If they're made well, they can express RNA, microRNA, which is really important. But exosomes essentially are just a huge source for hundreds of types of growth factors, proteins, peptides. So there's a lot of really great things about the cargo, but where you get the cargo from is going to change where the cargo is going. So effectively, there's exosomes in milk and blood and urine. We don't want to use that for, anti-aging and regenerative properties or processes. So it's really what is in the cargo is the whole conversation.
So if we look at what the cargo is, we're trying to define that. I think that, there's a lot of companies out there. They do the research that they can, but they may not have be able to do that to the extent that we do. So let's even dial it back a click further, and that is what makes an exosome. What truly is an exosome? What are the things that we would look for to say that's an exosome?
Right. So the crux of the industry is everyone's bragging about how many particles they have, microvesicles, exosomes, but essentially they're just looking at things that are about this size on the scanner, and they just assume that they're all exactly what they are hoping for. The only true way to know that you have a true exosome that's biologically active is you have to know that these have the right RNA expression. We have to make sure we know the DNA sequence is correct in the cells on the way in. We have to make sure that we are validating RNA, not only that it's even present and being expressed, but actually unraveling the sequence of the RNA to look at the bands and see what kinds of concentrations we have. Is this exosome, does it have the right CD markers? Is it even coming from the stem cell that we say it's coming from? There's potency analysis, there's assays we have to do. There's a lot of different ways we can test to make sure we have the right thing, and most companies really don't do extensive testing just because it's frankly too expensive or they're just choosing not to.
Well, I guess we can say testing matters. I mean, there are scientific modalities, and I know that, we're not going to have a science class here, but there are a lot of different modalities that kind of come into play when we're trying to find all this information, the proper identity, the purity, the potency. So let me ask you this question, first of all, is testing regulated?
No, there's no, aside from having, the companies that are in the market, they have to do like, sterility testing, endotoxin, mycoplasma testing. That's it. There's no requirement past that to validate exosomes and fully characterize them.
Okay. Well, I guess we could safely say that marketing does not equal science. Is that a fair statement?
I would say that's a very fair statement.
So how much of the market takes the time, goes to the expense of doing the type of testing that we're talking about?
Well, at our laboratory, we have about 30,000 square feet and about $100 million invested into our lab. And to our knowledge, no one is even near the level of testing that we do. The vast majority of the products in the market are barely tested, if at all, and a lot of them are just companies that are trying to, ride the wave of the exosome, trend, and they're having a lot of white label things made. And if they're not actually a laboratory, I don't know how they're testing it at all.
Yeah, and I would imagine that trying to find a lab and a line of labs that can do what you can do is going to be a significant challenge to say the least. But let's do this. Let's actually hit some of the very specific parts. And so we know that particle count, or what we might call the count of exosomes, we hear how many million, how many billion, how many trillion. Why can't I trust particle counts from other companies? What's all in the soup there?
It's a part of a multi-tier way to characterize exosomes. What that test does, and everyone uses the same device to do it, is they set it up to say, okay, measure anything that's between this size and this size. And effectively, it's about 40 nm to about 180 nm. And the idea is that anything that shows up on that test will show up as a dot on the screen, and then it quantifies that, and then that's your count. Now, there's a lot of things that are that size. Viruses are that size. Microplastics are that size. So just because you have something that is showing that size, it doesn't validate that you actually have a biologically active real exosome. It just says something's that size in your serum. It could be cell debris. There's a lot of things that could be the size that we're gating it at, but it's not a full confirmation of anything other than there are some things that are that size, the size of an exosome, or the range of what exosomes can be. And that's the whole test. You get nothing more than it
Wow.
could be one, but it doesn't necessarily say you really do have one.
That really changes the playing field.
Right.
So let's talk about potency for a minute. What would potency infer? What does that actually mean?
Well, obviously, if exosomes are, if you have a quality exosome, more the merrier. We do want to have a potent amount of exosome in count, but we also want to measure everything else, the potency of what peptides and proteins are being produced, growth factors, and actually classifying them to know which ones are there. What's interesting is in our QC process, we want to make sure that they're the same every time. We're using the same source of cells every time. We're not using a different donor every time. So we can create a really consistent product that's going to give really consistent outcomes.
That you just hit on such an important point, and we're going to drill down on that one in just a second, because that actually really separates what we're talking about from the masses. So when we talk about the cargo, and I throw around the term, mRNA, microRNA, how does that, what is that RNA value factor? What's important about that?
Well, the truth is, the RNA to us is one of the most, probably the most important part of the whole process with these exosomes. We've focused on that from day one. That's really what makes a biologically active exosome. If you don't have RNA, it's not being guided to where to go. So you could have great cargo, just like our product, but if the RNA isn't seeking out cytokine profiles, it's not seeking out inflammation, it's just diluted through your body and not really hitting the target. So RNA is going to seek out aggressively these inflammations that are occurring in the patient for whatever is being treated, and then the microRNA is going to unlock gene expression in cells that are senescent or deficient.
Wow.
Without the RNA, the exosomes have no idea where to go. You have cargo with no motor on the truck to pull it.
Super important. So what we're saying here is we need to be able to prove, and if we were comparing a product one to another, it's going to be, what's the RNA value? Is it actually there? And you talked about powdered product, lyophilized product. There's big questions as to what's the vitality of RNA that might still be even in that product. And so let's switch over to one more category here, which is, how do we ensure sterility? What are the sterility practices around that and measuring that?
Gotcha. So we hope everyone's using the same standards. We are a GMP facility. We use ISO 5 to ISO 7 clean rooms and devices. The picture behind me is a really good example of one of our multiple clean rooms we have in our laboratory. Everything we do as far as our COA level sterility, microplasma, and endotoxin testings are always third party to keep assurance to our customers that that's being tested without bias. But we also do internal monitoring as well. So we have environmental monitoring where we're actually measuring these things daily, weekly to make sure there's no contaminants in our clean rooms. And we also back up our, the same kind of test for sterility of microplasmas and endotoxin as well, just to make sure that we're having, a system of checks and balances.
I would figure most labs have some of those types of sterility things in place. So I think in terms of all the things we're talking about, sterility, as important as it is actually not at the level of, is the cargo there? Are the rest of the elements there that can deliver the benefit?
Well, one of the most important parts when we're talking about sterility and guaranteeing a safe product is to make sure that we're also doing 100% visual inspection. What I mean by that is after we produce the product and it's vialed and sealed, we have a team of people that will spend sometimes, the rest of the evening after production into the night looking in this, dark room with different color backgrounds and different lights and microscopes to basically make sure there's not even a scratch in the vial, there's no debris, there's no particles in it whatsoever. And that's actually what's required by the agency to eventually have an IV quality product that's approved. There's a lot of products out there that don't come in the same kind of see-through vial. They're in they're in cryo vials that are opaque. You can't see through them, and they're being sold, which means there's no guarantee that they can tell you that's a sterile product.
Wow. Well, I think certainly for Omnigenics and for you as our lab partner and manufacturer, we all want to stand behind our product 100%. We want to know that we have the gold standard, and this type of validation really proves that. So the core tests that are involved here, and I know that we could geek out on the science here for a while, so we'll try to keep it at a high level, Mike. But let's talk about some of the most important aspects of testing as it relates to some of the equipment involved that might be particularly unique to what we're doing.
Yeah, I'm sure there's no lab that has the list that we have. It's quite long, but to kind of give a summary, obviously sterility is a given. The tests we've already discussed are given every single lot. We never skip those. Like I said, we do DNA sequencing on the cells. On the end product, we're doing RNA sequencing. We're pulling apart those bands to make sure that the ratio of the most important, RNAs, microRNAs, tRNAs, they're all consistent every single time. I'm pretty sure none of our competitors, maybe one or two that even have RNA sequencing technology. It's not hard to get, but it's just a lot of work, and we're collecting data looking 10 years into the future. So that's why we do it every single lot, all these tests. So we want to validate that we have RNA. We want to see what, amounts we have of which one. We want to make sure we have the right CD marker. Is this exosome coming from the cell that we say it is? We go through potency analysis. We do spectrum ID5. We're doing qubit fluorometers, Invitrogen, iBlot. There's a lot of these different devices and equipment that we have that lets us actually go through it. That also includes Western blot imaging. And what's probably the most impressive one is our D-storm microscope. There's only so many around the world of any type of laboratory. We were the first company to get one of those early on when they started making those, because it was a very new technology, very expensive. And we can even take a photograph of a singular exosome and use technology to identify the CD markers on the surface of the exosome. That was the first time that ever done. When we did that, the company that made the tech actually gave us a call and asked how we pulled it off, but it was pretty cool. We see that photograph that we published online on a lot of competitors' websites, so you're welcome for that, the world, that we've produced that. You've taken it from us, but it's the real thing. And every single vial we've ever made, it was gone through this process. It's never, ever skipped. We want to guarantee real biological active units, real exosomes that have that RNA expression, that are still alive, and we want to make sure that our providers are comfortable giving their patients something they can count on.
I got to sneak in this question because I think I'm aware that there was a unit or something that was named after Dr. Ross, like the R unit or something along that line. What the heck is that?
Well, the thing is, when we went through the process of getting our cell line approved with the FDA, no one had ever fully characterized an exosome. For the longest time, everyone was calling it, textbooks were calling it, cell debris or cell waste. Eventually, when Dr. Ross made the discovery of how important exosomes really are and invented the space for everyone, he wanted to figure out what was going on with them, what was in them, how do they work. And we had to spend about $30 million in 3 years proving to the agency that we knew that this was a safe, real, and effective option for producing these exosomes using these cells. So essentially, we had to invent the way to characterize it. And that took a lot of time and years and money. But that process was really, is now in our normal QC process when we're producing these products, and every single lot was what we had to do to actually prove to the agency, who knew nothing about this new thing, that it was real and it was here to stay. So it's been something that we created, and Dr. Ross thought it'd be funny to call it the Ross unit. We're just now calling it the biologically active unit. But essentially, if you take all the things we've talked about, the proteins, the peptides, the RNAs, the CD markers, that there has to be an equation to build value on measuring ours versus others. And we hope it becomes a standard. We don't need to call it Russ. It's fine. I'm sure he's okay with that. But at the end of the day, if we're really talking about, all right, do you have a real exosome? Well, how do you measure that? And that would be the way to
Right.
do it. Yeah.
Yeah. Well, I think that there's got to be, Mike, there's got to be labs out there that can do the same type of testing that you're doing, that we do on our product. I mean, are we really the only one out there that's invested this kind of time, money, energy, resources? You
Yeah.
know, it's difficult, it's expensive, and it requires some expertise.
Right. So there are labs that have, every piece of equipment in our laboratory, not all of them all at once. To our knowledge, there is no lab in the world that has the exact list of things that we have. And I'm not talking about like every little detail, but like the major pieces of equipment we have. Um, the point is, if we wanted to have somebody else characterize our product, they'd probably have to spend a lot of money to catch up to what we have in our laboratory because we're so specifically dialed into exosomes. That's all that we do. The equipment reflects that. So yeah, if we wanted to have somebody else characterize that unit, we'd have to probably split it up between a bunch of labs.
Right. Okay, so there's one other qualifying point here, which is really not highly scientific, at least from my standpoint, but it does say a lot about the story. So I know there are other providers out there. They're taking, whether it's Wharton's jelly, umbilical cord, MSCs, and getting the exosomes from that, and they can make those products. I don't know, very quickly, maybe 72 hours, 3, 4 days. I don't know how long does it take to produce the type of product and going through the validation that we do. What's the difference?
So when you look at products that are lyophilized, which is the majority of the market, they probably we have lyophilization technology we use for other reasons in research and development. We can make cosmetic products if we want to doing it that way that are really not going to be exciting or clinical in any way because they're not going to be biologically active. What we know is the RNA is not you can't retain it using that process. Well, it only takes 48 hours to make those products. Our process from right when we start making a lot to actually going through all the characterization, all the testing, having them, quarantined until we have everything signed off for and everything's approved by our QC team. It's up to 8 weeks.
Wow.
Yeah.
That's a significant difference than
Yeah.
3, 4 days, and I'm sure the cost associated with that is,
Yeah.
is quite different as well.
Yeah.
So I think at this point, and when I look at what we're doing, certainly as a company as Omnigenics, we want real potency, we want real safety, we want real outcomes, and
Hmm.
so I guess my question to you is, bottom line, Mike, why is this information, and we're talking about now the testing and the validation, why is it not a top concern for more people who are in the exosome space?
There's a lot of, and I hope we continue or start to really find really great competitive products because that pushes all of us forward. Unfortunately, there's a lot of labs that want to get in the space and they don't realize how difficult exosome manufacturing is. And it's just, they're small labs. A lot of these companies have little incubator labs or shared space or white label teams. And when you do that, you just don't have enough control to
Hmm.
drive where it needs to go. Frankly, not a lot of teams have $100 million. There was two companies that actually got VC funded at the beginning, maybe 6, 7 years ago. Over $100 million invested in these exosome companies. They went
Wow.
bankrupt because they just couldn't get there fast enough. We've been doing this 11 years. We're the ones that started it. We're going to make it the long haul. We're the farthest as far as this, our status with the agency and our clinical trials.
Yeah.
We've just been lucky that our team of brilliant, amazing people have done all the work. It's been, not blood, but sweat and tears for a long time. And it's just really difficult to enter the space. Most of these teams are much smaller and they just don't have the resources that we did.
Well, one of the other aspect that I think is important, it really kind of puts the spotlight on it, is the fact that the other competitors, for the large part, are seeking out the Wharton's jelly. They're getting one umbilical cord after another. They're constantly having to go through these initial steps where we've
Right.
taken, 8 years plus with one single source. So how important is the single source process or product versus what the others in the market are actually doing? Because I think it's one of those. I think that helps us really hit the gold standard and beyond.
Yeah, so I mean, it's not to say that some of these products can't work quite well in certain indications, but when you have just much less tissue to work with, let's say in the form of an umbilical cord, you don't have enough cells to be able to make a master cell line to have a single donor source. And if they say they
Hmm.
do, our PhDs are confused. Um, so there's just also not enough tissue or sorry cells in this case to fully characterize it every single time. So you would just run. between your third-party testing for sterility and mycoplasma or mycotoxins and endotoxins and mycoplasma, you just don't have enough to test it and characterize it because you have to use all your
Right.
end product to
Wow.
run through these machines and stuff. So that's why they don't do it. Is it's more economic than it is scientific. We just knew that we were going to do it the whole time. It's for all the data we're masking.
So there's some exciting advancements happening in terms of recognition of all this painstaking work that Dr. Ross has gone through, that you've been a part of for a long time now. Is the health span contest? I mean, I only bring that up because it's a real public recognition of the work that's been done up to this point. You want to just hit on that real quick?
Yeah, the X Prize is a huge deal. We're very excited about it. The first one was the race to space between SpaceX and Blue Origin,
Yeah.
Virgin. But now they're focused on anti-aging and improving human life by extending the quality and the length of life. About 670 global biotech companies submitted a lot of data. Only 40 were selected, and our lab was one of the 40. So we're semifinalists now. We were the only exosome company that was selected. So it says a lot about our data. We're actually showing data that we absolutely changed the length of telomeres. We are reducing life. This is reducing genetic age. We can take lab tests for patients and show them that that we're changing those telomeres. So it's an interesting and exciting time. But we think we're going to do very well in the competition.
Amazing. Is that next year? Are we going to be awarded the big prize?
We will get our first place prize. It's probably it's going to be at least probably looking at up to 2 years, maybe a little bit longer. So once you get in, you have to put through the work and do actual a study and prove everything. So it's a lot of fun, exciting times ahead.
Well, that $100 million is going to go a long way toward a bunch of studies. So that's
Yeah, we
very,
got to
very
pay for the
exciting.
studies, man. We got to win this thing. So.
So I think that as we kind of wind this up, Mike, I really appreciate the clarity in what you've brought here from a testing standpoint. It helps people be able to evaluate the market, because I know that every practitioner wants to make the best choice. They want the best product because they want the best outcome, and that's how they really serve, their clients, their patients, etc. So from my perspective, and I'm sure yours, validation matters. The science matters, the process matters, and we get to lead through that science and through that validation. So we are so excited to be partnering with you in the process. So thank you very much for being with us today.
Absolutely, and likewise.
Mike, the last 20 minutes, absolute gold mine. I've just been sitting here listening and just so very fortunate to be on this call and just be working with you and your crew. A parting comment, and I have a reason for asking this, because we deal with people like I'm about ready to describe that are getting ready to supply 50, 100, 200 practices across the country with exosomes. They see the epiphany that's happening right now in the space. What, if you could just take the last 20 minutes and bring it down to just a couple comments of advice for them, what would it be?
Good luck. It's a mess out there. There's a lot of it's like trying to see through mud. But don't be afraid. What you should expect to be able to get answers on. Ask your reps, ask the labs that you're working with. The questions that we reviewed today. It's great that you've got 100 billion or 100 trillion or gazillion exosomes. What do you know about them? It's nice that you're hopefully getting reports back about proteins. Growth factor types, that's the first and foremost, okay, that's good. Let's keep moving on. What are your CD markers? Are you validating them? What is your RNA, profile and content? How much of it do you have? What types of them do you have? What's your QC process? Just dive deep into the things we covered today, because really the ones at the end of what I just mentioned are the most important. You want to make sure this is a biologically active exosome. It's got a full RNA profile, the strongest you possibly can find. And if they don't have answers to their RNA or their CD markers, they probably don't have a real exosome.
One last question. Is it possible to take Wharton's jelly, which seems to be the sort of ties all the competitors out there together from a sourcing standpoint, and create an exosome that competes with the technology that you folks own?
It's a completely different product. When you use something like Wharton's jelly, you're in the tissue category. We are not. There's no tissue, no DNA, no antigens in our product whatsoever. These kind of blend products is what we kind of describe them as. They just kind of blend up tissue and just count it as an exosome product. And there very well may be exosomes in there. Now, I don't know the quality of them whatsoever, but you will now have a vial that actually has a tissue ID number on the vial saying that this is a tissue product. Those products cannot be guaranteed to be sterile because when you do sterility testing, you're sampling parts of the lot and the rest of them aren't there. There could be tissue, there could be cell debris, there could be a myriad of things that we see when we use Wharton's jelly, for example, in the orthopedic space. There are flares. And if you're using that other than for a joint injection, I'd be a little afraid to use those products.
Thank you very much. That's awesome. Really, really appreciate you, and we really appreciate your product line.
Of course. Thank you.